All right, so coinciding with Women's Month, from the 1st to the 7th of August, 107 countries celebrate Breastfeeding Week. According to research conducted by the NGO Save the Children, South Africa has the lowest number of women who breastfeed in the world. Could it be because baby formula is being punted as better for children despite the expense? Has the government's Breast is Best initiative not been successful? Well, Debbie Farnaby from Save the Children is here to explore some of the issues behind the statistic. Debbie, good morning.
Good morning.
I raised two questions in that introduction. You know, what's the reason?
Well, we don't know what the reason is. The research has been done by the World Health Organization and ourselves. It indicates that South African mothers breastfeed exclusively for 6 months, only 8% of the time. Now, put that number into context. Swaziland is at 44%, Tanzania is at 50%. Nigeria is also low at 14%. So why are we so low? So we've done some work. We've been working out. We have a number of programs out in the rural provinces where we've been working with mothers, and we've trained a number of healthcare workers in terms of understanding better what are the causes for women to move away from breastfeeding.
Do we have some of the answers, though? I'm really keen to find out,
we
know,
do
why.
have some.
Yeah?
There has been historically an understanding or a belief system that said that that HIV/AIDS could be transmitted in breast milk. This is not actually the case. And even if the mother is not on antiretrovirals, they do still encourage breastfeeding for the first 6 months as the best nutrition available. And I think you've got to balance things up. You've got to balance between the nutritional needs of the child and the facilities available to the mother. If there's no access to sanitation and clean water, the child is very likely to die from diarrhea as a result of formula feeding. And so we really want to balance between what is available to the mother to ensure the best nutrition for the child versus, you know, what is the best health outcome for the child.
Okay, Debbie, let's make it really simple. You know, you have a mother who is in front of you, who's just given birth, who needs to know, what do I do? Should I breastfeed exclusively? Should I combine with formula? Some mothers feel they don't have enough milk, and so they need to supplement with formula. I don't think there's an argument anymore about whether breast is best. I mean, it contains all those enzymes and different bacteria that children,
yeah, absolutely, all the immunity.
Just go back to the argument again and make the case for why it is better for those who don't know.
Okay, so breast milk has in it a whole lot of immunity. It has all the nutritional value that a child needs, far better than any formula milk. Mothers who do formula feed, they'll tell you that they move from one formula to the other to find the right formula for the child, whereas the breast milk that we produce is perfect. Okay, Mother Nature really does know best in this case. So if I had a mother sitting in front of me saying, what should I do? The answer would be, if you can breastfeed, do. If there's a problem with the mother, you know, in terms of not producing enough breast milk, yes, she's going to have to supplement in terms of formulas.
And let me stop you right there. How do we know? Is it when the baby cries and seems to be hungry? Is that when they need to consider perhaps supplementing?
So it's the natal visits, it's going to the clinics. If the child is not thriving, it's not gaining sufficient weight, then we know. You know, babies will cry. Sometimes there's still developmental issues happening outside the womb. The stomach still is developing in terms of being able to accept foodstuffs and so on. And so we need to work through a process of, is the child thriving or not? Or is it underweight? And, you know, we've also done some really interesting studies on what are called the Child Development Index, which measures how well we're treating our children in terms of weight, getting to primary schools, and nutrition. And so these things all come into play in terms of how well are our children thriving. And unfortunately, we've dropped 24 places as South Africa on that index.
And one would imagine in a country where, you know, against which, you know, we have a huge backdrop of poverty, that it would be the logical choice for mothers who can breastfeed to simply do so, because formula is expensive.
Absolutely. The government did subsidize formula, and that's why it became so popular. It was available from the clinics, and so mothers felt that this was the right way to go. You know, every mother wants the best for her child, and so she's going to follow the advice that she's actually getting. And we need to get out there in the public consciousness the fact that breastfeeding is better and it is safe if you are HIV positive.
All right, if you're HIV positive and you're not on ARVs, can you breastfeed?
Yes, you can. It's not ideal. Okay, because if there's any breast problems in terms of sores around the breast and so on.
But not because of the virus.
No.
So let's make that point again.
If the mother is HIV positive, she can still breastfeed even if she is not on antiretrovirals. First prize is that we have a comprehensive care system that allows the mother to be tested, to get the necessary antiretrovirals if they are available to her, to ensure the best mother-child care. In those circumstances where we can't get perfect, and we can't, you know, We live in a country where, unfortunately, we have huge divides. And we have mothers out there who don't have access to running water, who don't have access to food for themselves. And then we need to balance. What can the mother actually do? Breastfeeding is always best, and they're safe. If you can get on the antiretrovirals, so much better, because the mother will thrive in terms of the milk that she's giving to the child as well.
Debbie, you've said so much that I'm sure is going to be invaluable information to every breastfeeding woman in South Africa who can hear this program. Where can people go for a good resource? We know the primary healthcare clinics are equipped to give out this information,
yes,
but where else can they go to really reinforce the message and to allow them to have the best breastfeeding etiquette?
So all of the NGOs are working in this area. We're just one of them. We're trying to make it as the information as available as possible. We have been working to train clinic sisters how to have a good breastfeeding regime, if I can call it that, how to safely breastfeed, how to ensure your child gets the best nutrition. We would really encourage mothers wherever they can to go to the clinics. If they can't get access to the clinics, we are hoping that there will be the spread of information, and we are working to develop this flow of information so that it gets to the really rural areas to help our mothers.
Thank you so much. I hope that people listen and take heed. Debbie, we appreciate your time.
Thank you.
That's Debbie Farnaby from Save the Children.